coming on. Hey, Facebook family. Hey, Instagram family. How are you doing? Today is Friday. Are you excited about Friday? I'm excited about Friday because this time yesterday it was full of wonderful people. Today is quiet. I'm here in the office. Jonathan's here in the office. We're getting some work done. But most importantly, I'm here with you guys. So, hey, thank you for joining me on this Friday, as you always do. I'm Dr. Joy Freemont, better known as Miss Dr. Lady, here in Hapeville, Georgia, which is right next to Atlanta, Georgia, for those of you who do not know. But I'm here with you live every Friday around 12 noon or so, live on Instagram and live on Facebook. So I'm very honored, as I always am, that you have spent the time with me and taking the time to spend with me. I'm Dr. Joy Freemont, straight out of Atlanta, born and raised here in Atlanta, and I'm so excited about that. There are not many people who are in Atlanta now who are from Atlanta. So, hey, if you are from Atlanta originally, say hey. If you're not, welcome. If you want to be, stay where you are. We are extra crowded right now, but you can come visit, but you gotta go home. Anyway, that wasn't very nice, but come on in. I'm Joy Fremont. Thanks for coming. 404-761-1659. That's 404-761-1659. If you want to come see us, we're at 606 South Central Avenue in Hapeville, Georgia. That's 606 South Central Avenue in Hapeville. If you want to send me an email, you can go ahead and do so at office@thehapevilledentist.com. office@thehapevilledentist.com. So if you're here with me today, please say hey to me below. Just say hey. I love to say hey to you. I love talking to a room with some people in it. And I also love seeing you on the replay. So if you're catching me on the replay, just type the word replay below and I will definitely say hey to you. And also, if you would like to share this, I would be very honored for you to share this with everyone you know. So I'm here to give you your tips for this week. As you know, it's almost Thanksgiving. Thanksgiving is coming up. And if you are into holidays, this is one that's big, okay? I love it when people actually take the time and celebrate Thanksgiving and don't skip over it and jump right to Christmas, because we are always, well, at least I am, always grateful for everything that I have, everything I've ever have, and things that I'm about to have. I'm so grateful to spend time with family and good friends. So if you are going to celebrate Thanksgiving all day and not go shopping on Thanksgiving Day for Christmas, drop that down below too. Just say I'm in. I am in Thanksgiving all the way because I believe in it. I'm not judging you. I just want to see. I just want to kind of see, okay? And for those of you who are in Atlanta, we are open next Monday, guys. I know. I'm never open on Mondays. You know I'm never open on Mondays. But the schedule is almost packed. It's almost 100% full. So if you need to come in on Monday, give us a call today and leave us a message and we'll try to get back to you. But our schedule is almost full. But we're here Monday, we're here Tuesday, and we're here on Wednesday of next week. My mom asked me, are you really working on next Wednesday? People have to cook and get ready. Not me, because I don't cook. So, hey, I'm not in that number. So I get to enjoy food on Thursday that somebody else cooks. So if you're inviting me, just let me know, girl. I'll come by. I'll come by. I can bring something. It's nothing that's cooked. I'll come. Okay. So also on next Friday, I'm doing a special edition of Miss Dr. Lady's Tips for Your Teeth. It's the Ask Me Anything edition. You can ask me anything you want to ask me, okay? So if you want to think ahead, go ahead and shoot me a line. You can send me an email. You can send me a comment down below. Send me an instant message on Facebook. You send me a DM on Instagram. Ask me anything you want to ask me. And as long as it's not very, provocative, I might answer that privately, but I ain't going to answer it on the air, okay? So ask me whatever you want to ask me. You hear that train behind me? Like I said, I'm in Hapeville, so you hear that train. Welcome to Hapeville, all right? Well, today I am talking about sugar. No, not that kind. I'm talking about diabetes. And if you are part of the African American community, we normally call diabetes sugar. I got sugar. That means you have diabetes. Well, we're talking about that today because Thanksgiving is coming up, and I know the majority of you are going to overindulge, just like you all got it in on Halloween. I know you got it in on Halloween because I got plenty of candy out of people's teeth the week after Halloween. Okay, so hey, Yimmy, your old sweet daddy, how you doing, boy? So I definitely want to talk about diabetes today and how it relates to your dental health. Okay, as you all know, I mean, everybody who's listening to me has heard of diabetes. It is, this is for you then, Yimmy. Okay, you got to listen, Mr. Neville. Diabetes affects 29 million people just in the U.S. alone. That's a lot, okay? So it's very common. We don't like it, but it's very common. 2 days ago was actually World Diabetes Day. I'm thinking, like, why are we hyping that up? But I'm thinking we have World AIDS Day, we have Breast Cancer Awareness Month, we have Heart Month, so why not Diabetes Month? It's time to get aware and more aware. People who don't have it don't know all about it. People who don't have it mainly don't know anything about it. But I'm talking today about it in your teeth, okay? There are two types of diabetes, type 1 and type 2. And just to make it very simple, type 1 you're born with, type 2 you develop, okay? Type 1 you're born with, type 2 you develop. And a lot of times what I'm very excited about are the people who have type 2 diabetes and get rid of it. So that's something that's really big to me, very important, and it's very doable, okay? Either way it goes, diabetes, whether it's type 1 or type 2, diabetes affects how your body processes sugar. Simple as that. I'm not going real deep with guys today about it, not getting real into the scientific parts about it. Just know that diabetes affects the way your body processes sugar. Now, you know, whatever you eat, your body breaks it down, turns it into energy, which we call sugar, glucose, right? It turns it into it. And so depending on what you eat and how your body is made up will determine how your body reacts to it, all right? So as far as diabetes, it affects all parts of your body, from your eyes to your liver, to your kidneys, to your heart, your skin. I mean, of course, your teeth as well, okay? So we want to make sure that you keep that under control. It's very serious. Do not play with diabetes, okay? Because you have diabetes, yes, it can affect your heart. You've seen diabetics who lose their sight. You've seen diabetics who lose limbs. They lose their toes because it's not controlled. And I want you, if you're listening to me, to control it and to get better. Our goal is together is to get off of it, okay? As far as your mouth is concerned, one thing that you can look forward to, not look forward to, but notice in your body is a dry mouth, okay? If you have diabetes, you're at a higher risk of having a dry mouth. It also affects the way that you taste your food. Your food may taste differently. And the dry mouth affects how your taste buds are, okay? So that's why maybe your food tastes differently. Also, maybe because your medication you're on. Also, you're at much higher risk of having mouth infections, okay? So you say, I was wondering because I have had a couple of teeth to chip from out of nowhere. Exactly, okay? Your mouth is dry. That means you have a decrease in the saliva. Your teeth are not being as moist or moisturized as they would be. So anything that's brittle is going to break. It's kind of like on a tree. Once you take the leaf off of the limb or the tree, it dries out because it doesn't have any kind of moisture coming through it and it cracks more easily, right? Exactly. So that's why your teeth are breaking off, okay? And I know your granddaddy used to take care of your teeth, but if you do not have a dentist, Mr. Neville, please go get one, okay? We want those teeth to be healthy, all right? Rest in peace to Doc, all right? Next, your gums may bleed. Your gums may bleed a lot if you have diabetes. Next, you're at a higher risk of having fungus infection, which is called thrush, which is candidiasis. And yes, it is a yeast infection. Yes, it can occur in your mouth, okay? Not getting all freaky on you, but yes, you've seen babies with thrush. You can have it as well, especially if you're diabetic. You're at a higher risk of developing thrush in your mouth. And as kids, children who have diabetes, their teeth growing faster. Wow. Bet you didn't know that, right? So these are things to look at. If you're not diabetic and you're having any of these symptoms, if your children have any of these symptoms, please go get tested, okay? Go to your medical doctor, get a simple blood test, and see if you're diabetic or pre-diabetic. If you're pre-diabetic, let's go ahead and reverse that, okay? Also, if you have type 2 diabetes, you have a 50% higher risk of developing sleep apnea, okay? And if you have sleep apnea, it makes your diabetes worse. Yes, it does. Okay, you say you're still terrified of the dentist. Come see me. You know me. I'm right here in Atlanta, okay? Do not be afraid of this. I want to help you, okay? All right? So if you have sleep apnea, it can make your diabetes worse if you're not treating it. So keep on wearing your CPAP. Please use that CPAP. If you have a sleep appliance like I have, I'm not diabetic, but I have a sleep appliance because I have sleep apnea. Wear your appliance. If you have not been tested and you have diabetes, please get tested. I've always told you all, you've heard it over and over again. Come see me. We do free screenings for sleep apnea. Come and see me. All I want is for you to get better, okay? And also, as I said before, diabetes can lead to heart problems. Who wants that? All right. I also mentioned before, if you have an infection in your mouth and you're diabetic, it's way, way, way harder for you to fight that simply because you have poor sugar control, poor blood sugar control. So understand, I probably say it every single week. Your body is an entire system. Okay. So don't think that because you have diabetes, it ain't serious, because it really is. So what can you do? What can you do? Number one, control your blood sugar levels with diet. Whatever your doctor told you to do it. Stop being this internet Google doctor, okay? Thinking you can do it on your own. Go to a trained medical professional. Get a nutritionist. Find out what they say. They're the ones that can understand it, not your Google Doc, okay? I'm very serious. I'm tired of you guys going online and finding out the answers. Don't do it, okay? They don't do it, all right? Number two, take your medication as prescribed, okay? Take your your medicine as prescribed. You say, I don't need my medical doctor. You just scoop me on the whole condition, talking directly to me. Hey, well, I'm a doctor, so I say you listen, right? So I know what I'm talking about. Well, thank you for listening. Thank you for coming today, okay? And then exercise. Do what you can to control your blood sugar. Number two, if you smoke, stop smoking. Diabetes and smoking is a recipe for disaster, okay? Just smoking alone raises your chance of having gum disease. Then diabetes raises your chances of having a fungal infection. And then also raise your chances of having cancer. Hi, Jonathan.
We're going to re-emphasize the exercise part.
Come on in. All I see is your head.
Well, I didn't want to
Hey, Jonathan.
We're going to re-emphasize the importance of exercise.
Now,
There's nothing to be flown through. It is part of your day-to-day life.
You want to get a little closer? Thank you, Jonathan. I told y'all earlier that Jonathan is here. He never comes on camera, but he got it from his desk, came way over here to tell you about exercising. Obviously, I need to exercise some more, okay? But he is talking to not only diabetics, but everybody. Exercise should be part of your life, I guess. Hey, John. Okay, he's gone. Good. All right, so stop smoking. I mentioned that earlier. Diabetes, smoking, don't do it. Next, brush and floss 2 times a day. You got to do it. Remember I told you earlier, it's harder for you as a diabetic to fight infection. So if you do not brush and floss every single day and get that stuff off of your teeth, the plaque, the bacteria, it's going to be harder for you to fight the gum infection if you ever have one, okay? Then, this is for you, Mr. Neville. Go to the dentist. Let us find out things that may be wrong with you, or fix things before they get bad, or prevent things before they even happen at all, okay? Come in for a cleaning, all right? If you have dentures, retainers, your appliance for sleeping, clean them every single day. If you have Invisalign, clean your aligners every single day, okay? You do not want that old plaque to build up in your mouth. For one, it just smells bad. I'm sorry, I'm a dentist. I smell it all day, but that's what I do. You don't want to be the person who has diabetes and bad breath. We'll talk about that later, okay? So those things that you can do, all right? But what can I do as your dentist is, one, treat your gum disease. I can treat it and we can help you fix it. But one thing that we in my office don't particularly like to do is treat it and then you not take your part at home, okay? LaWanda, you have your appointment. Thank you. Yes, can't wait to see you. All right. If we sit here and get your teeth all cleaned up, get you back to health in this office, you have to do the work at home as well. Okay? We can clean your teeth all day, but you can leave out my door, go down the street, get something to eat, and then go home and not brush your teeth again. Keep doing that over and over again. It's going to build right back up. So when you come to the office again, it's like, dude, what happened? You have to do your work at home. We're going to love on you here, but we're going to fuss at you too. You got to get it in. You have to take control over and take ownership of your condition. We're going to help you as a team. And you see me, I'm always smiling, but I get mad too, okay? We want you to get better. And I don't want to be more concerned about you than you are, okay? All right? Also, if you're coming to the dentist and you're diabetic, eat before you come. Also, if you're on medication like insulin or any kind of diabetes medication, take it before you come. And also when you come, bring a snack. Yes, there are times when people come here and they're already nervous. I know. As cute as I am, people are still afraid of me, guys. I get it. But they're afraid of the dentist. And I understand that. I get it. I understand. But I definitely want you to not be so afraid that your blood sugar goes way up and way up and way up because of your fear. And then you go into a diabetic shock or diabetic coma. And it does happen. So eat before you come to level it out. Take your insulin before you come to level it out and bring a snack. There's nothing wrong with it, okay? We're on the same team, okay? Yes, we do have things to help you if you do go into a crisis here, but we want to make sure that you take care of it as well. And you're right, LaWanda, we only get one set of teeth that are yours. You can buy some, like you can buy a weave, you can buy a wig, you can buy some teeth. But what's better than your own, right? It's all natural like this. Hey. Okay, so anyway, that's what I have to say today about diabetes, okay? We don't want it. We don't want you to have it. But if you do, we can help you with it, okay? There's nothing at all to be ashamed about. We're all here to help you, all right? So I know I smile, make fun, make laugh about it, but it's nothing funny about it. So make sure you take care of your body. We're going to help you. We're going to help you. We're going to help you, okay? So if you would like to come see me, even you over there in North Carolina, you can come see us. My number is 404-761-1659. 404-761-1659. If you have any questions about your diabetes, you can call me, send me an email, send me a message below, leave a little comment. If you're real private, send me an instant message. I'm on Facebook and I'm on Instagram at Freemont Dental. I'm halfway on Twitter, but don't go over there. Just Facebook and Instagram, and just holler at me. This is me. This is who I am, okay? And don't forget, on next Wednesday night, we're going to always have our What If Wednesdays right here live with my entire staff, acting silly. And also on next Friday is the special edition of Miss Dr. Lady's Tips for Your Teeth. It's the Ask Me Anything edition. So beforehand, send me your comments, your questions you want me to answer live on air about me personally, about what I do, about the office, about your condition, whatever you want to ask me. It's up for grabs, okay? This is your one time to get it in. I'm getting personal with you next Friday, okay? So have a fantastic weekend. I know it is cold here in Atlanta. I know it's snowing in different places around the country. Please be careful wherever you are. Have a fantastic weekend. Get it in. Have fun. Whatever you're doing, be safe. Brush your teeth, floss your teeth, and all that kind of stuff. Okay? You know I love you guys. Thank you for watching. Have a good day. Bye. Bye, Emil.